This is a public service announcement concerning chlamydia in New Orleans, Louisiana. According to the Centers for Disease Control, of states with the highest rates of reported cases, meaning people who actually got tested and were positive for the disease, Louisiana is ranked second in the U.S. for chlamydia incidence rates. Even more worrisome is the rate of chlamydia in New Orleans, which is the highest in Louisiana at 691.6 per 100,000 people, far outranking any other region in the state. So what is chlamydia? Chlamydia is a sexually transmitted infection in humans caused by bacteria that is transferred from the blood and fluids of an infected person during unprotected intercourse. The disease transmission is devised of three parts: the host, sexually active individuals; the pathogen, bacteria called Chlamydia trachomatis; and the environment, sexual contact involving blood and bodily fluids. The incubation period for chlamydia ranges for each person from days to months and is often called the silent infection, as only 10% of men and up to 30% of women show symptoms of infection. If you do see symptoms, they might include painful urination, lower abdominal pain; in women, vaginal discharge, painful sexual intercourse, and bleeding between periods and after sex; and in men, discharge from the penis and testicular pain. The duration of infectiousness, or how long someone can get you sick, depends on treatment. A person can remain infectious with the disease, spreading it to others until they receive full antibiotic treatment, which can effectively cure chlamydia. But even after treatment, it's recommended that a previously infected person abstain from sex for 1 week following the last dose of antibiotics to prevent further spread of the disease. Risk factors for chlamydia include being sexually active, particularly at a young age. It is estimated that 1 in 20 sexually active young women aged 14 to 24 has had chlamydia. Next is inconsistent use of condoms, as well as having multiple partners. So what can be done to decrease exposure to the pathogen and limit vulnerability to you? Well, the New Orleans Health Department will be implementing new community control measures. We will be offering free STI screenings to patients aged 25 and under, confidential referral for at-risk sexual partners, free antibiotic treatment in our clinic, and improved public health surveillance and notification or data collection, analysis, and reporting. But without your help, the disease incidence rates will continue to grow. This is why we're asking you to practice individual prevention and control measures to prevent and stop the spread of chlamydia. These include using condoms every time you engage in sexual activities, limiting your number of sexual partners, abstaining from sexual activities, getting screened for sexually transmitted diseases, and talking to your partner about possible exposures and screening services for chlamydia. Healthy choices can change you, your community, and the world. Thank you for watching.